Hi, my name is Dr. Snel and I'm the owner of Snel Chiropractic in Curacao. I'm a chiropractor for more than 25 years now and I was always very interested in the biomechanics of the spine. A good friend of mine and a colleague, Dr. Thierry, introduced me to CBP, which is Chiropractic BioPhysics, and I took the course with Dr. D, and believe me, it has been an eye-opener. CBP is the only technique that has been researched for more than 30 years, and now we know exactly how the spine is supposed to be. We can compare each patient with a normal spine. By taking x-rays, which are very crucial in CBP, we can exactly measure how the spine of each individual patient looks like. With that, we can come with specific exercises, specific traction, and also global adjustments in order to correct the spine more towards normal. What causes the spine to misalign? Things such as car accidents, lifting out something heavy, bad postures at work, and also sleeping posture, and also things such as texting, which is right now an epidemic with younger kids. They're texting the whole day, changes the structures of the spine. When the structure of the spine changes, what will happen is that the neck or the lower back or the thoracic will shift to one side or the other, forward, backwards, or a combination of all those. By taking an x-ray, we can measure exactly what's going on and come up with specific treatment plans. CBP will correct the spine towards normal as much as it can per individual. Sometimes you will not get completely normal, but more towards normal so that we can improve the symptoms of the patients. Now I will demonstrate a patient that will be lying down on a general table. This patient has been through many chiropractors without results. She also is a patient that has been diagnosed with fibromyalgia, and she has a lot of chronic neck pain and pain between the shoulder blades. First of all, I would like to thank Ms. Bezem for being a patient of us today. Right here we can see that we placed a Demerol under her cervical spine in order to create a new cervical curve, because she presented with a curve that was less. Also, she presented with an anterior head carriage. We place a headpiece with a little bit amount of weight in order to push the head backwards. On the lower spine, on the thoracic spine, she presented with an anterior thoracic translation. This strap will push on her chest and push the thoracic back into the correct place or to the On the lower spine and the pelvis, Ms. Bezem presented with a increased pelvic tilt. What we're doing here is we're blocking the pelvis and we're pushing on the buttocks in order to decrease the pelvic tilt. Ms. Bezem's spine, cervical spine, also presented with a translation of her cervical spine towards the left. And with this technique, we're pushing the spine back towards neutral by pushing the spine towards the right.
Ik heb 36 behandelingen gehad in totaal. In het begin was het wat onwennig. Ik moest natuurlijk de andere kant op van hoe mijn spijn eigenlijk in elkaar zat. En hield ik het niet zo heel erg lang vol. Door mijn fibromyalgie heb ik natuurlijk al hele gespannen spieren. Dus is het dan ook wel wat lastiger om je te ontspannen. Uiteindelijk, na een minuut of 4, 5, voel je dat je lichaam het laat gaan en kan je het dus op een gegeven moment gewoon volhouden. In het begin was het 5 minuten, op een gegeven moment 10 minuten. Uiteindelijk heb ik het 20 minuten volgehouden. En deed het eigenlijk niet zo'n pijn meer als in het begin. Aan het einde eigenlijk van de behandeling heb ik het zo ervaren dat ik in het begin helemaal geen rugpijn had. Nu heb ik vele malen minder rugpijn. Ik slaap dus beter. Mijn nek, idem dito eigenlijk. En dat geldt ook voor de schouderbladen. En doordat ik een betere slaap heb, heb ik ook een beter humeur. Oefeningen zal ik moeten blijven doen, omdat fibromyalgie bekend staat als wat gespannen spieren, met spierspasmes. En iemand die dat niet heeft, ja, zal waarschijnlijk ook wel wat minder pijn ervaren.
This is Ms. Bezem's pre and post x-ray. The green line represents the normal cervical curve. This is how it's supposed to be. And the red line represents how Ms. Bezem's neck x-ray is on the side view, meaning looking in the Miss Basin on the side. This is the face, and right here is the back part of the neck. You can clearly see the distance between the red line and the green line on top, meaning that the head is positioned forward. You can also see that the neck here is pretty straight. After CBP, you can clearly see the distance between the red and the green line became less, meaning that the head started going backwards, and also that the cervical curve started to come in right here. And you can see that this distance between this and this is less compared to this distance right there. This is a front view of the cervical spine of Miss Basin. You can clearly see the difference between the green and the red line, how much it is, this distance. And after CBP, the distance reduced remarkably. This is a lateral x-ray of the thoracic area. The red line represents how Miss Basin's thoracic spine was. The green line is representing the normal again of how it's supposed to be. You can definitely see how much of a difference there is here. And after CBP, what we had is completely synchronization of the green line and the red line.